Nearly 500,000 hip replacement surgeries are performed every year in the U.S., bringing pain relief and renewed mobility to a growing patient population. Advances in orthopedic surgery include the anterior approach to total hip replacement, a less invasive procedure offering less pain, greater postoperative stability, and faster recovery.
Where I trained out in the East Coast and West Coast, anterior total hip replacement is very prevalent. However, in the Midwest here in Michigan, patients are hearing that you can stay overnight and go home the next day, getting back and returning to your office type jobs in 2 to 3 weeks after a major hip replacement surgery. This has really changed the paradigm in the area.
The traditional posterior entry requires a longer incision and violation of major muscles. In the anterior approach, the surgeon is able to part those muscles through a smaller, less invasive window. The surgery is performed on a special HANA table that enhances femoral exposure for more precise implant placement.
The patient is laying supine or flat on their back on a HANA table where we are now going through that direct anterior incision. This incision provides visualization between the muscles themselves where we can get access to the hip joint itself. We're parting through a natural tissue plane between muscles where we are achieving access to the hip joint where the arthritic joint is visualized. The acetabulum is then prepared, removing the labrum, and the cartilage loss on the end of the bone is now exposed. We then dislocate the hip with the assistance of the HANA table, lowering the leg and removing the head from the acetabulum, showing the arthritic joint. We then make an osteotomy or neck cut where we remove the arthritic bone. This will allow preparation of the acetabulum itself. Once we remove the ball, we then place the cup into the acetabulum where we put a polyethylene liner. Now the femur is rotated with use of the HANA table, again broaching or preparing the femur and placing a titanium stem. Once we prepare this and reduce this, we're able to get an x-ray at the time of surgery, which is the benefit to having the HANA table. This allows access to get accurate images to place the stem and cup in precise positioning, and then placing a ceramic ball on the junction of the stem, and now relocating the hip in place. Again, not violating the muscles. The muscles fall back into a natural alignment, and we suture up the skin after the procedure is performed. Since we're not violating these muscles, ligaments, and tendons with the anterior total hip replacement, hip dislocation is very rare. They're ambulating and getting up and walking the night of surgery. They're able to do stairs the following morning in physical therapy. Over 95% of my patients actually go home and do not go to a rehab or nursing home facility with the anterior total hip replacement. It takes a surrounding team to support this.
Holland Hospital provides that for Dr. Johnson in a very coordinated team effort.
It's education to the nurses in the room, to my assistants in surgery, to physical therapists, to the nursing staff, and to the whole team surrounding the approach itself.
The medical team has yielded outcomes that far exceed national averages in terms of dislocation, days in hospital, and discharge to home, all of which contribute to Holland Hospital's growing reputation as a spine and orthopedic center of excellence.
Holland Hospital has definitely grown in its reputation in terms of excellence in both joint replacement as well as orthopedic surgery and orthopedic treatment.
I travel probably once a month teaching surgeons from all over the country the anterior total hip replacement procedure. I also have surgeons come and observe me in surgery, and I also will go and assist them in surgery as well.
The anterior approach is also advantageous for revision surgery and partial hip replacement.
I just did a patient just recently who is in her 80s who slipped and fell and broke her hip. I did an anterior approach with a hemiarthroplasty. We are also doing revision surgery through an anterior approach.
One of the biggest things that we hear after a patient goes through the anterior approach is not only how surprised and amazed and happy they are with the outcome, but also everyone kind of tells us that they wish they did it sooner.
Once they realize that the recoveries are a lot sooner and they're able to get back, patients say to me all the time, "Why did I wait?"
That's what we do this for, is getting them back to life as they knew it without hip pain.
For more information concerning the anterior approach to total hip replacement, ask your physician or contact the Bone and Joint Center today.